Welcome. Today I'd like to speak about critical challenges in global health and their implications for action. By the time you finish this session, you should be able to outline the key challenges to improving health globally, discuss the implications of these challenges for national and global action, and review the implications of these challenges as well for individual and collective action in public health and in clinical medicine. The approach I'm going to take will very much follow the objectives that I've just outlined. But in addition, I'm going to spend a substantial amount of time on discussing the context for global health for reasons I hope will become clear to you. So let's in fact move on and begin by talking about what I call some of the important contextual issues in global health. Some of you will know about the work of Professor Amartya Sen, who is an economist, a Nobel Prize-winning economist, although the economists, we like to say, often think of him as a philosopher, and the philosophers often think of Professor Sen as an economist. But I assure you, in any case, he's a truly wonderful and truly great person who has done much to make the world a better place. Professor Sen wrote a book called Development as Freedom. And in that book, Professor Sen postulates what is called the capability theory. And I'm going to suggest to you that it's really important as we think about international development and global health and public health, that we have some notion about what this is all about. Why are we doing this? What's the role of governments? What's the role of a health system? What are we after? And Professor Sen, who I had the good fortune of meeting on two occasions, suggests to us, I believe, and I'm really paraphrasing a 600-page book in many ways, in one expression that Professor Sen thought was a not bad way to do it. Professor Sen suggests that the goal of a government should be to enable everyone in the fairest possible ways to be all that they can be. I want to repeat that the goal of a government should be to enable everyone in the fairest possible ways to be all that they can be. Now, we can't guarantee that everyone will come out the same, but most of us watching this, or all of us watching this, would agree that everyone deserves the same chance to be all that they can be, and that governments must play an important role in that. If we believe this, and I certainly do, then I would say, taking our inspiration from Professor Sen, we might suggest that the goal of a health system is to maximize the health of a population at least cost in the fairest possible ways. Now, in some respects, therefore, what we're really after is we want a world in which everyone lives a long and healthy life. We want a world in which more and more people live, for example, like the Norwegians, and fewer people live like those living in some of the poorest countries who have short lives, often full of ill health. So again, we want everyone in the world, and that's everyone, to live a long and healthy life. Now, I've often been accused of dwelling too much on bad news and on the things that are still wrong with the health of the world. But I want to ensure that I begin by reminding everyone there's a lot of very good news in the world of global health. Certainly until COVID, we were living in a world in which people lived longer than ever before. Fewer women died in childbirth than ever before. Fewer young children died than ever before. And there had also been progress against a number of important diseases. And polio and guinea worm are nearing eradication. In addition, when we think about non-communicable diseases and their risk factors, there's really been an enormous amount of progress, for example, in reducing the global prevalence of tobacco smoking. So I want to highlight for everyone the extraordinary amount of really good news that's taken place in the world of global health. Now, this good news doesn't just come about by itself. Some of this comes about through the actions of countries working largely on their own. Some of it comes about through global cooperation. When we look, for example, at good news that's come about as a result of countries working largely on their own, we can look, for example, to Bangladesh and the extent to which fertility has been reduced in Bangladesh, I believe faster than anywhere in the world, largely through the extraordinary efforts of this country, working with its people, with its government, and also with an extraordinary non-governmental sector that's played a really, really important role in Bangladesh in helping to enhance the health and well-being of Bangladeshi people. Turkey has made enormous amounts of progress in child health. It's a middle-income country, but they've done very good work in developing their health system, identifying critical issues that constrain the well-being of their children and addressing them. Poland in the same in controlling tobacco. On the other hand, and Egypt, which sadly faced an important outbreak of hepatitis C because of the sharing of unsafe needles and unsafe injection practices. Egypt really has led the world in trying to eliminate hepatitis C and now is providing assistance to a number of other countries. When we think about cooperation globally, we can think, for example, of Botswana and the early assistance for HIV/AIDS, an antiretroviral therapy that Botswana was able to bring together and make good use of. We can think of the extraordinary efforts to address childhood vaccine-preventable diseases through the work of the Pan American Health Organization and a number of countries in Latin America, led, may he rest in peace, by one of the great global health heroes, Dr. Ciro de Quadros. And we can think of the important work, for example, that Morocco has done in the elimination of trachoma through cooperation with organizations involved in these efforts. So I want to repeat, there's an enormous amount of good news. This doesn't come about, I also repeat, on its own. Often it comes about through actions of countries that are able on their own to take these measures. But in addition, there's a lot of important progress in global health that's been the result of global cooperation. On the other hand, you wouldn't be taking this course and you wouldn't be watching this video if you weren't deeply concerned about what I like to call the unfinished agenda in global health. In 1921-22, there were still around 5 million deaths each year of under 5 children, 99.9% of which should be preventable. There's still an exceptionally large share of those deaths that relate to malnutrition, undernutrition, and an exceptionally large share of under 5 children in the world who are underweight, who are wasted, who are stunted. There are still practically 600,000, around 600,000 malaria deaths, and way too many people dying of tuberculosis and HIV, despite lots of efforts to address them. And despite important progress in reducing maternal deaths, there are still around 300,000 maternal deaths every year and countless maternal morbidities as well. And then when it comes to the so-called wormy diseases, the parasitic diseases, something like 1 in 7 or 1 in 8 people in the world is infected with some of these diseases. And as we know, when we think about non-communicable diseases, we have to be greatly concerned at the extraordinary rise of obesity and overweight and the extraordinary increases in the number of people in the world who suffer from diabetes. So although there's been an extraordinary amount of good news, there remains an unfinished agenda in global health that's very large, that is unacceptable to, I'm sure, everyone watching this video, and which we need to address wholeheartedly at the level of individuals, the community, nation states, and the globe. Now, as I begin to talk about the critical challenges, I just want to remind you of one other really important contextual issue, and that is that global health challenges and how we address them are inextricably political. We've known this forever, But in many respects, COVID highlighted the extent to which public health and global health measures are political. There's a political overlay. In many respects, that political overlay has gotten deeper, it's gotten wider, it's gotten more intense. And we need, as we think about critical issues in global health and what can be done to address them, we need to be very sensitive to the political context within which we're operating at every level. That being said, let me move on now to giving you kind of Skolnik's take on the critical challenges to what we might say is achieving health for all. There are a number of organizations, including the World Health Organization, that regularly publish their list of top 10 critical challenges. There are individuals and colleagues and friends who do the same. But this is what I would say are the most critical 8 challenges to global health or health for all that I would like to highlight today. You could fairly ask me, so tell me, Richard, what led you to these 8? And I would say that here is something like the criteria for including them. In the biggest sense, the most important criteria in a way is to say that these are the global health matters that keep me up at night. But to be more specific, I could say that it's important for me to include in this list contextual issues that will be very hard to solve and that will have a big impact on global health, threats that in a way can bury us, but for which we're not prepared, preventable DALYs, preventable disability-adjusted life years from the leading burdens of disease, gaps in achieving universal health coverage, and disparities both within and across countries. So let me make just a few comments then about each of these, what I call most important critical challenges. The world order has changed. It's still changing. We might not have liked very much the post-Cold War order that existed. We might not have thought that it was as fair as it needed to be. But I want to suggest to you that there are really extraordinary challenges now in the breakdown of that order, the extent to which some actors are trying to create a new world order that I do not think will be as good for the health of the globe as what we've been moving toward. There's an increasing amount of conflict, including some very large conflicts that directly affect the lives and well-being of people, and at the same time further break down the possibilities that countries will work together to address critical challenges in global health. We might have thought that COVID would have made the world less nationalistic and more willing to cooperate, but that didn't really happen, I would suggest. And at the same time, in this kind of an environment where we still need lots of assistance financially from a number of countries that will hopefully work together to address key issues in global health, I think we're as likely to find out that their concerns for themselves and their fatigue over long-run financing of global health issues may get in the way of the kinds of measures that need to be taken and need to be taken expeditiously to address the concerns we're talking about here. At the same time, there is a growing anti-science agenda, especially in my own country, the United States, but really more than in the United States and, in a sense, globally. There's always been vaccine hesitancy, but in many respects, vaccine hesitancy is growing. It's being coupled with political issues and political parties. This is also giving rise to an increasing amount of anti-science notions, and public health, which was once considered kind of a godlike area for important work by very caring people, is more and more under attack. And I don't see any time in the very near future when this growing anti-science and anti-vaccine agenda is going to disappear. Now, let me take a break and say, nonetheless, despite this, some countries have not succumbed, and it's not inevitable that countries will succumb to the anti-science agenda. And here's a list of a number of countries that have done a very good job in trying to ensure that they continue to develop their health programs on the basis of the best available evidence and knowledge that we've gathered globally. Thailand has been a leader in the development of universal health coverage, starting with its famous yellow card scheme. And today, life expectancy in Thailand, whose per capita income, I think, is only 1/10 that of the United States, life expectancy in Thailand is now 3 years longer than the United States. In Mexico, they had some years ago a really extraordinary program of developing evidence to try to serve as the foundation for a universal health coverage program. There's been some back and forth as political leadership has changed, but Mexico certainly provides the world with many lessons. And in Ethiopia, which remains a relatively poor country, there's been an exceptional amount of progress in developing the health system and addressing critical health needs of the poor. And Rwanda has developed its very famous community-based approaches to health insurance. So although we're living in a world in which there's an increasing and very difficult anti-science agenda, often coupled, I repeat, with political actors, I also want to say again that succumbing to this is not inevitable, and every country needs to do what it can to try to ensure that it continues to take the best and most evidence-based practices and approaches to achieving universal health coverage. COVID was, in many respects, kind of the ultimate global health issue. It brought out all of the key issues in global health, but it also highlighted that we have tended repeatedly to take an approach to emerging and re-emerging infectious diseases and antimicrobial resistance that's moved from real complacency, a lack of caring and a lack of action, to panic when the disease emerged, and then back to complacency when we thought that things were getting better. And it looks like things are not so different now. But I think one of the things that COVID also brought out, which most actors in global health and leaders in global health did not expect to happen, was the extent to which the response to COVID reflected political impediments, including leaders who refused to take an evidence-based approach to COVID, and administrative failures, even in some of the highest income countries in the world, in carrying out what we know to be the basics of public health. And it's important, I want to suggest to you that here too, I think it's not at all clear that these are going to disappear anytime soon. And by contrast, I think we have to imagine we'll be living for considerably longer with some of these same kinds of impediments on the political and the administrative side to addressing emerging and re-emerging infectious diseases and antimicrobial resistance, which, as you know, are going to continue to occur. The main thing I want to say about the unfinished agenda of Group 1 causes is that we know what to do, but to a large extent have failed to do it well, particularly in the poorest countries and particularly with respect to helping the poorest people in the world to enhance their own health and well-being. We know as well that I grew up in the world of global health at a time when, mistakenly or not, correctly or not, I should say, we believed that the overwhelming concern had to be on Group 1 causes: maternal, child, nutritional, and communicable causes. But long before I left my work at the World Bank, it was very, very clear that no country had the luxury of worrying only about Group 1 causes. And we know now that every country has to worry about, including the poorest ones with the highest burden of Group 1 causes, even they have to worry about non-communicable diseases. And we know that the burden of non-communicable diseases will continue to grow thanks to the demographic transition, the epidemiological transition as countries do better in health. We know that in addition, there are issues that go along with aging populations, including dementia, with which we're going to have to be very concerned. There are a range of mental health issues that are roughly the same throughout the world and a very substantial burden of disease. And there's also growing issues in substance abuse disorders and alcohol use disorders in many countries. And yet, in the face of this, there are really very few adequate models throughout the world. Countries that have addressed NCDs, non-communicable diseases, effectively, efficiently, quickly, and fairly. And at the same time, there remains very little global funding for non-communicable diseases in those countries that may wish to address it, but which nonetheless lack the financial resources to do it. So we must be very, very concerned about non-communicable diseases everywhere. There was very important progress in universal health coverage in many countries, including many countries that are resource poor prior to COVID. But we all know that COVID dealt a real blow to health systems everywhere, including health systems in resource scarce countries that had made progress in achieving universal health coverage. And at the same time, COVID also created a financial blow and created financial hardships in many countries as the economies were hit badly by the numerous effects of COVID. It's going to take some time for the world to overcome this and some real rededication to the notion of universal health coverage if that's going to happen. Equity and disparities are central to our concerns for global health. And I want to remind you that we need to be looking at equities, disparities, inequities, not only across countries, but also within countries. We know, for example, in Pakistan, that a rich woman who lives in Karachi and can go to the Aga Khan University Hospital for delivery faces probably no greater risk of dying in pregnancy than a well-off woman in a well-off country. But by contrast, we know that in the poorest provinces in Pakistan, for example, the risk of a poor woman, a poor rural uneducated woman from an ethnic minority dying in childbirth might be 300 times. The risk of her dying in childbirth might be 300 times, for example, the risk of the better off, better educated woman who can have a delivery in a first-class hospital in a large city. Issues of inequity, issues of disparity will not disappear anytime soon and must remain, of course, absolutely central to everything that we do in global health. It's also going to be really important to address the challenge of harnessing science and technology in ways that are quick, in ways that are fair. I'd like to remind everyone that, for example, I was a polio pioneer. When the polio vaccine was approved for use in my own country in 1955, I believe, I was 6 years old and happily got the vaccine. But it remains terribly, terribly, terribly disappointing to me that now 45 plus 20, 68 years later, it's wonderful that the world is close to eradicating polio, but it's disgraceful and totally and utterly unacceptable that it should have taken the world 68 years from the development of a vaccine to get where we are today, which is close to, but not quite, to polio eradication. There's an enormous need for developing new diagnostics, vaccines, and therapeutics, for ensuring that they're available throughout the world, including among our poorest people, and for ensuring that it doesn't take 25, 35, or 40 years for these technologies to get out from wherever they've been developed to widespread use in a way that can help us to ensure health and well-being of everyone wherever they live. So let me end by talking about what can be done. What are the implications of some of these issues for action? There are many, and I'm only going to highlight a few, but I want to suggest again that we think about context. We remember what we're after, and that's a world in which everyone, no matter where they live, has an equal opportunity to be all that they can be, that health systems have an opportunity as fast as possible, at least cost, to enable the maximum health of populations everywhere, and that trying to achieve these aims will have to be carried out in an environment that's not only political, but that's extremely political in some places, and also in many places, we face political leaders who themselves aren't particularly caring about the health and well-being of their people, or aren't particularly interested in ensuring that the health and well-being of their people is addressed through the most evidence-based, cost-effective, and fairest possible ways. This highlights the importance, in whatever capacity, for each of us to try to ensure that when we have the opportunity to choose leaders, that we choose leaders who care about these critical challenges in global health, who care about what we said is a desirable end game for development and for health, and who will do what they can on the basis of the best available science and evidence to make the world a better place. Increasingly, a lot of the anti-science effort is well organized and it's well funded. I've mentioned it's not going to disappear on its own, and I want to encourage each of you, in whatever capacity you can, to do what you can to fight that anti-science agenda. Climate change is fundamental. Many people believe that climate change will be as important as any issue that we face. And we need to be thinking and working all the time about mitigating the impact of climate change and dealing with its effect on health. And as I mentioned, we need all the time as well to be trying to reduce the gap in the time it takes to develop diagnostics, vaccines, therapeutics, and to ensure they're disseminated in the fairest possible ways throughout the world. There are many, a lot of writing has been done, a lot of very thoughtful writing by people who know much more than I do about what can be done to prepare for and address the next pandemic. But I think one of the things we need to do is think about what can be done now. We can't wait until the next pandemic occurs. We know that new diseases will emerge and reemerge, and what we need to do is take measures now to stage equipment and supplies, ensure people are trained, ensure that different countries' health systems have prepared for and engaged in modeling what's going to take place and how they can best address it. We need to do, as we speak, there are global discussions to create a new pandemic treaty and to revise the international health regulations. It's not at all clear that this will be successful. And we need to do all that we can to help move the world in these directions. We need, in a world of increasing burdens of non-communicable diseases, including in some of the poorest countries, to be working together to gather more and more evidence to find out what works in cost-effective, doable, sustainable, and fair ways on the side of non-communicable diseases, so that we can try to head off the extraordinary burden of non-communicable diseases that many countries, including many of today's lower income countries, will face. And as I mentioned, we also need to think about renewing the vigor and the commitment to universal health coverage in in the most equitable ways, and trying to overcome some of the gaps that were created by COVID. When we think about ourselves as not only as citizens, but we also think about our work in public health and in clinical medicine, again, we need to stop talking about climate change, But as we gather more and more evidence about it, we also need to ensure that all that we do is sensitive to the potential impacts of climate change in our own communities and in the wider global environment. There are still gigantic gaps in stewardship for antimicrobial resistance, and we need to pay more and more attention to ensuring that in more and more coordinated ways, the public health and medical communities do what they can to address antimicrobial resistance. There's an organization called Last Mile Health, and I like the name of this organization as well as a lot of the work that it does. But if we're going to try to address and enable the poorest people in the world, the least well-educated, the most marginalized, et cetera, to enable their better health, we need to focus more than we do now on community-based approaches to communities that are kind of beyond the pale, that live in what we might call that last mile. Part of this has to be, of course, locally based approaches and community-based approaches to understanding vaccine hesitancy and to addressing it. We need to ensure that we advocate at every step of the way the importance of universal health coverage in the most equitable ways. We need to advocate in many ways much more loudly than we have the importance of moving forward in health on the basis of the best available evidence and in ways that can address the anti-science and the growing anti-science agenda. I don't like to talk much about my book, but I think we've learned from COVID and from other things that have happened in the last several decades of the importance of One Health and the importance of more and more taking a One Health approach to everything that we're doing in public and in global health. And I wouldn't be surprised, for example, if the 6th edition of my book, somewhere around 5 years from now, I hope I live that long and live healthily until then, if that book doesn't very much take a One Health approach to global health. And finally, I want to suggest to you that we need to do all that we can as individuals, as concerned citizens, and as actors in public and in global health and in medicine to rebuild trust, some of which has been broken down around COVID, and some of which is breaking down further through the push by those engaged in what I call the anti-science agenda. So let me end by saying there's been an enormous amount of good news, but there remains an exceptional amount of bad news, a large unfinished agenda that must remain the focus of all of our attention. There are a range of critical challenges to sustaining the good news and addressing the bad news, and I've tried to highlight 8 of them that are of special concern to me. We can't wait. We need to face these challenges now at the global, national, and local levels. We largely know what needs to be done. We know what's doable, sustainable, cost-effective, and fair for a very large part of the unfinished agenda. And we need to ensure that we do it and do it rapidly if we're really going to help to achieve the kind of world that Professor Sen outlined and that I highlighted as well. So you'll see on the slide some selected references, and there are many more. There are a number of people who were very helpful to me in putting this presentation together, who looked at the drafts and made very valuable comments, and I'd like to thank them publicly. And finally, let me thank you for watching this. I hope that you continue to appreciate the course, The Essentials of Global Health, and I look forward to reuniting with you again in the not too distant future. Thank you very much.